If your child has a runny nose, save this list because I'm going to give you a complete list of everything that's guideline recommended. Daily nasal spray and drops are always a great first line. You can also use a nose Frida. This is really going to help loosen mucus and really reduce that congestion and runny nose. Now, if there's sinus pressure, you could use ibuprofen, only if they're 6 months or older. And then for any age, you can use acetaminophen, and be sure to check the dosing with your pharmacist. Now, if you suspect it may be allergy related, you may want to use an antihistamine. First, you can use Allegra, which is the brand name for fexofenadine, and you can use this in children young as 2 years. Next is Zyrtec, which is the brand name for cetirizine. Though on the box it says for 2 years or older, you can actually use this in as young as 6 months, but when it comes to dosing, check with your doctor or pharmacist. And then also Claritin, which is the brand name for loratadine. You can use this in children as young as 2 years old. One antihistamine I will not be recommending for your children is Benadryl, which this is the brand name for diphenhydramine, because one, it can either make them extremely drowsy, or it could result in a paradoxical reaction where Benadryl is almost like a stimulant. And if you have ever given your child Benadryl and you saw how hyperactive they become, I can tell you, you will never want to give them Benadryl again. And if we're going the natural route, a cool mist humidifier is so important to have. This will keep your nasal passages moist and reduce any mucus flow. With this, you're just gonna be using at night. Also, warm baths are really great to loosen like nasal secretions. You don't need to go all out though, like this picture. Also hydration like water or breast milk, because this can thin mucus and help it drain. But if after doing this and symptoms are still lasting for like 10 to 14 days, then you do want to see a doctor.